Thank you so much to all viewers of my video about non-surgical treatment options in Peyronie's disease. I didn't expect it to be such a huge success, so I decided to do another video on collagenase, which I sort of left out in my other videos since it is a treatment which is basically available in the US only. If you're watching from outside the US, this might still be interesting information for you. However, Xiaflex is not licensed in Europe. Welcome to UroChannel. My name is Stefan Buntrock. I'm a specialist in urology and sexual medicine. On UroChannel, I am dedicated to deliver medical information on urological topics from the point of view of the professional who is dealing with these conditions on a daily basis. However, there is a catch. A YouTube video can't replace a visit at the doctor's. So if you have a health problem, go see your local physician. When it comes to non-surgical treatment options in Peyronie's disease, collagenase injections are one of them. If you haven't watched my video on the nature of Peyronie's disease, please go to this link so that you can understand why and where in the penis connective tissue formation occurs. Connective tissue contains collagen fibers, and collagen is the stuff that can be found in bones, among others, but also inside the penile plaques in Peyronie's disease. So to break down these plaques, you need something that destroys collagen. And here's where collagenase comes into the picture. Some bacteria produce a substance that does exactly that. It is possible to culture a bacteria named Clostridium histolyticum and extract collagenase of them, which then can be used to break down the plaques in Peyronie's disease. It simply has to be injected into the plaque, where it then does its work. However, once injected, there's one more thing to do. The penis has to be stretched and straightened manually several times a day for the medication to take effect. The whole treatment consists up to 4 treatment cycles. One cycle consists of 6 weeks, initiated by 2 injections 1 to 3 days apart, followed by a period of manual penile modeling. Problem is, Xiaflex, that's the name of the medication, is incredibly expensive. In Europe, you could easily buy a small car for the price of just 1 injection, and you would discard almost half of it each time. So some centers have modified the dosing by injecting all of it at once, leave out the second injection, and shorten the treatment cycle to 4 weeks. The success rates are quite good actually. In clinical trials, the curvature changed significantly with a mean decrease of roughly 30%. When going through the literature, there seems to be a difference between calcified and non-calcified plaques, with a superior outcome for non-calcified plaques. Again, when putting all the pieces together, no matter what treatment, there seems to be a repeating pattern. Calcified plaques don't do well in non-surgical therapy. This is why I stopped treatment of calcified plaques with shockwaves, but still continue in non-calcified plaques. So whatever the treatment, it all comes down to an early diagnosis with a treatment plan prior to plaque calcification, because when calcification sets in, it makes things so much harder. Is Xiaflex suited for every patient? Certainly not. It is not to be used in plaques in between the corpora close to the urethra because of possible stricture formation. There is also a lower threshold of 15 degrees in curvature. Additionally, there are possibilities for side effects. Swelling, pain, blood blisters and bleeding under the skin are almost inevitable following the injection. Looks gross, but is harmless and will resolve after a couple of days. One of the serious side effects would be corporal rupture, where the tunica albuginea of the corpora cavernosa bursts. In these cases, surgery has to be done to save corporal function. According to the manufacturer, corporal rupture occurs in 0.5% of the patients treated. I've seen higher numbers in the literature though. Personally, I think that collagenase is a promising treatment option for those who want to avoid surgery. But, as I said in the beginning, it is no longer licensed in Europe, unbelievably expensive over here, so that it will be reserved more or less for US citizens only. Thanks for watching. Bye bye.